just one. Thank you, Zoom person. Thank you all again for being here. As Janae said, this is the fourth and final session in a four-part series looking at different ways that we can integrate health equity into work that we are already doing. And this session is really going to focus on community and multi-sector partnerships as part of that work. Prevent Connect is a national project of Valor US, sponsored by the US Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the US government, CDC, or even Valor. We've been using these objectives throughout the series, and so we will continue to gain a deeper understanding of health equity frameworks in our prevention, translate concepts of health equity into practice, and think about how we can create cross-cutting strategies and partnerships to address the determinants of health and ultimately prevent violence in our communities. So here's one of those other polling questions that I promised you, and that is, we're just interested in knowing if you attended other sessions in this web conference series. I know that many of you have, because we've had a relatively small group. The last three sessions have been specifically designated for CDC recipients and their subrecipients. So I will just give 5 more seconds. Okay, I'm going to go ahead and end the poll, and you can see a little over half of you participated in this poll. Most of you have been in other sessions. I'm not sharing the results. Okay, now I am. So a couple of you have not. Guess what? Good news. We have recordings for all of them if you are interested in seeing what happened previously. And then can't remember is always a very valid response for me. I put that there, but y'all do remember. So we'll go ahead and stop sharing that, and I'll put links to the recordings in the chat in just a minute. And as I said, if you did grab the slides, you already have links to all of those, and you can watch them now. We've been operationalizing a health equity approach to violence prevention through this, I guess, bit of a flow chart, thinking about ways that we can create accessible access to power to be able to improve environments where people conduct their lives, and ultimately to eliminate sexual and intimate partner violence in our communities. And that's kind of carried us through all the conversations that we've had up to this point. Session 1, we really focused on looking at how we could integrate health equity into the content of our strategies and approaches. We looked then at the implementation process in session 2 and session 3. How do we actually go about implementing these things in a way that increases equity? And then today, as I said, we're looking at partnerships. Who are the leaders? Who are the partners that are really central to the success of a strategy and approach, and that also advances health equity? What are those relationships like? What are those characteristics like? And we're very lucky today to be joined by partners and leaders who are central to the success of Rhode Island's RPE strategies and approaches. So this is a spectrum from the movement strategy centered that may be familiar with many of you, or some of you may have never seen it before. It's always been really helpful for me to think about the different ways that community can be engaged or not be engaged. So you'll see that they have this numbered 1 through 5. There actually is a 0, and 0 is just completely ignoring community. So what this can be helpful in determining is kind of where you currently are. Are you just providing communities with information? Are you gathering information from them? Are you involving them into planning processes, having conversations? Are you actually collaborating and making sure the community has capacity to play more of a leadership and development role in making decisions about implementation? Or are we deferring to community? Are we actually letting the communities drive decision-making, and really fostering equitable participation. This is a spectrum, and they're likely, depending on the strategy or approach, it will be different where we fall. So I just want to kind of sit with that for a moment. And then would love to ask you all to kind of think about a strategy or approach that you are involving community in, and think where on this spectrum it's falling into right now. If you're at the inform stage, consult, involve, collaborate, or defer to. And what I'm going to do is I'm going to put up our third and final poll that will ask, where do you feel your current work with community falls on the spectrum? Are you still in the informing community stage, consulting community, involving community, collaborating with community, or have we really moved to community ownership of the strategy or approach? And so I really appreciate you all who are heading over to that polling question and making a selection. We have just under half of participants participating right now, so I'm going to let that number, I'm going to see if we can bump that number up just a bit. I love to try to get to 70%, but we'll see if we can do that in the next 5, 4, 3, 2, 1 seconds. Okay, we didn't quite get there. That's okay. We got over half of you. So it's really pretty evenly spread. And Karen, I see your point, and absolutely. I think that, again, depending on what the strategy or approach is, there are different pieces that probably look different on the spectrum. And that might be what this spread points to. And so let me share the results with you all so you can see that. You can see that about a quarter of folks are at the inform community stage. You're providing community with relevant information about the issue. Just under 20% are at the consult and involve community levels. We're almost at 30% with collaborating with the community, ensuring that the community they have capacity to play a leadership role in implementing decisions. And then 13% are deferring to the community and really kind of leaning into community-driven decision-making. So thank you all for sharing that. It's, I think always just helpful for us to kind of assess where we are. And I'll put a link to the Movement Strategy Center document where this comes from, because of course it goes into a lot more detail, and there's also some really great what is the word I'm looking for? Activities that you could actually do with your collaboration or with your agency to move up this spectrum, and put some goals into action. So I also wanted to share, Human Impact Partners has a guide on resources for collaboration and power sharing, specifically between government agencies and community organizations. So if you are representing a state or territorial health department, this might be a really helpful resource in kind of determining the role that the health department can play in collaboration and power sharing with community. Again, there's activities in here. There are assessments. I think it's a super helpful resource. So I will put a link to that in the chat momentarily as well. But with that, I want to introduce you all to our guests today, and we're going to hear from all of our guests. So we have Angela Kemp here. Angela is from the Rhode Island Department of Health and oversees RPE work in Rhode Island. Ryan Fontaine is with Thunder Mist Health Center, an RPE subrecipient in Rhode Island. Jay Watts is also with Thunder Mist. And then Andy Taubman is a collaborative partner with Thunder Mist from Youth Pride Inc. And so you are going to hear from Ryan, Jay, and Andy in just a bit, but we are going to ask you, Angela, to first kind of share with us the landscape of RPE work in Rhode Island, and lead into how this partnership with Thunder Mist came to be. And so I would love to turn it over to you.
Thanks, Ashley. Hi, everyone. My name is Angela Kemp, and like Ashley said, I use she, her pronouns. I work at the Department of Health and oversee the RPE work here in Rhode Island. And I'm going to talk a little bit about how we've invested in community leadership through our RPE program. Go ahead, Janae. So I want to give you just a little bit of information about our state. We are definitely one of the smallest states here in the US. And though we do have about a population of about 1 million people and have hundreds of miles of coastline, we do, however, have some of the economic disparities that come along with a coastal state. And you can see some of the areas where we have some health disparities and economic disparities as well. So there's an urban core to our state, and you can really see kind of where those are the darker shaded areas on some of the maps that I have here for us. Um, and I also wanted to just share a little bit of a fun fact about Rhode Island itself. And we are the home to the Hasbro Corporation. So if you ever visit Rhode Island, you're more than welcome to try to find all of the Mr. Potato Head statues that are scattered around our state. Next slide. So our RPE program at the Department of Health sits within our Division of Community Health and Equity. And as many of you know, I just want to clarify that rape prevention education funding is the CDC administered funding for sexual violence prevention, goes to states and territories, and now also state sexual assault coalitions. Um, Here, we're in the Division of Community Health and Equity at the Health Department on the Violence and Injury Prevention Program. And we have been really, really honored to be a part of the supplemental category B cohort that has been doing more work at the community and societal levels of the social ecology. And this was really an opportunity for us to tie our RPE program into a collaboration with our state's unique Health Equity Zone initiative, which is a place-based resident-focused opportunity to really look at the community needs for a specific geography and work with residents and the different stakeholders in the communities to address those community issues. And two of our partners are actually backbone agencies for those HES groups, including the partners that we are sharing with you all today. Thunder Mist is a backbone agency for two different HES in our state. Next slide. So there are probably about 1 million different ways that I could organize our RPE work. But for today's purposes, this is kind of how I'd like to frame it. We have 3 buckets here of community mobilization, women, youth, and gender expansive leadership development, and creating protective environments. On the left, there's a number of groups here that work across the state to either leverage resources, share, problem solving opportunities together, and to provide peer networks, but also to organize and respond to pressing issues either in the state or in a specific geography. Our women, youth, and gender leadership, gender expansive leadership, excuse me, has a number of programs that work with youth. There's the YWCA has been implementing Girls Circles programming. We have work with Young Voices, who's an organization that works within our urban core, working with youth to develop leadership skills so that they can go out and advocate for community change. And then we've worked also with some entities that are national to build peer education with our youth here in the state, both at the higher ed and K through 12 levels. And there are also 2 strategies that we have for creating protective environments, one of which is our partners that are here with us today. Thunder Mist hosts community empowerment events for our trans population, whether that's informational sharing about top surgeries, or more social events like hosting holiday events for the trans community during the holidays. We also are preparing some resources for our state, the health educators here in our state and the K through 12 system as well. Next slide. So during this past 5 years, we have really, and more in the past year and a half or so, in our last kind of end of our current cycle of RPE, we've engaged in some qualitative data analysis and collection to really understand where we made pivots during the 5 years, where our partners found opportunities, and really wanting to glean the lessons that we learned along the way. And I know that many of you all are working on imagining what the next 5 years of funding might look like. So we really wanted to share some of those high level learnings with you all. So we did some interviews with all of our different partners, and some of them were staff implementing the program, some of it were program participants. So we really dug in and learned from our partners along the way. Go ahead, Janae. Next slide. So the first set of themes I really want to talk about was the importance of adult allies and youth and young adult empowerment work. They really needed, those champions within the systems that they were advocating to help open doors for them. Next, the value of sustained funding for community organizing. This is really the main point of my talk, my little TED Talk today, is you gotta find the people who are in your community, who are members of the community, who are already engaging in the work to improve their own lives and the members of their community's lives. Often, and this certainly came out of conversations we had with our partners who are with us here today, often people are doing this work unpaid and after hours. Find those people and pay them to do it full time during the day. Like that is, I think, the singular most important strategy you can do to invest in community leadership in your state. And that really sustained funding and giving people the opportunity to do that work in a more visible way really championed the leadership here in our state. Next slide. All right, so we know through some of those community mobilization and peer support networks that we've built, including a statewide prevention coalition, that we are far more effective when we work collaboratively and when we build networks between the different stakeholders who are doing this work in our state. It really has helped us just get to know each other better. To be fair, that is a bit of a Rhode Island thing. You have a little bit of small town energy at a statewide level. But certainly knowing who the people are, knowing their names, knowing, their pets, what their favorite ice cream flavor is, all those silly little, icebreaker things that we do at the beginning of meetings has really helped us to just acknowledge each other as human beings who are working towards the same direction. And so that, I think, has really broken down some of the barriers that can come along with trying to do similar work in similar space. Next is the responsibility that we feel community has in owning sexual violence prevention. Oh, sorry, Janae, back one more. So certainly we can't do this work alone, and we are not the be all end all, right? Like we are not the ones. So we really need our community to take that ownership, to be the change. And so it's our charge to really make that happen, to create the conditions where that can happen, and to give people the information that they need to be able to understand the full scope of how we can prevent these issues. Okay, Janae, next slide. All right, and so the kind of last major theme I really want to share is how important it is that our work be trauma informed. We know that prevention, we like to think about prevention as something entirely separate from our intervention or response work with violence. But we know that these things don't really actually happen in isolation, that often when we are working on prevention, there's opportunities to respond to things, to disclosures. When we are working in response work, there's also opportunities to prevent future violence. So there's these things do not happen in isolation. They often happen simultaneously. And so therefore, we need to be trauma informed in the way that we approach this work. There's also just in the way that we build partnerships with the community also needs to be trauma informed and understanding community trauma. And so working really hard to build that foundation of trust, to create brave spaces for disenfranchised voices, and to really think about working in different ways that are more approachable to our community, and to do that consistently, even if they don't show up the first time, but to keep showing up so that you'll be there when they do. So again, I really wanted to share these lessons learned. Most importantly is to find the leaders in your community. And one thing that I will say is that also let them come to you. Make sure that you're making your community aware of the funding that you have, the breadth of what it can be, and letting those leaders come to you with the change that they know they need to see in the community. So I'll go ahead and end there. And my contact information is on the next slide. Please feel free to reach out if you have any questions. I know we're all working tirelessly on grant writing and imagining the ways that we can do this work differently. So happy to be a resource or to just chat with anybody.
Thank you so much, Angela. We are going to turn it over to our panel now. So I'm going to stop sharing. And Ashley, if you could pin all of our images, but I'm really excited to chat with Ryan, Jay, Andy, and still Angela about the collaborative work that you all are doing. Let me just pull the things up. Okay. Well, hi, Andy, Jay, Ryan. How are you all?
Good. Hi.
We are really excited to have you. Well, let's just get started, and Angela as well, kind of grounding us. Tell us a little bit about the collaborative work that you all are doing together.
So being able to start, so Thunder Mist is a federally qualified health center. We're a large health center in 3 different locations throughout the Rhode Island. We have a location in the northern part of the state, and the central part of the state, and the southern part of, big Rhode Island. But the trans health program is housed under our equity programming within Thunder Mist that involves both medical care and behavioral health care, as well as the external facing piece of our work. And that's the work that Ryan does. And so I'll give you a chance to talk about that specifically. But my role as the director of the program is to, I supervise our behavioral health clinicians and our direct clinic facing work, as well as support Ryan in doing the external work. So Ryan, why don't you explain who you are, and then because we can kind of lead into Andy and explaining our collaboration.
Everyone, Ryan Fontaine, she, her pronouns. My job title is Trans Health Education and Policy Specialist at Thunder Mist. And the position is actually funded through RPE, grant. And we're, as you all know, we're in the last year of the 5-year cycle. I came on in January, starting this work. And as Jay said, my role is really external facing. I don't do a lot of work in our actual health centers and in our clinics. I do work with our community partners and connecting with them, provide trainings both within Thunder Mist and externally around cultural competency in social service agencies, other health centers, schools, primarily in working with gender diverse folks. And then the programming piece that Angela also mentioned, where we do what we call as a big umbrella of empowerment events, and they can look very different and have looked very different, especially over time and as the needs of the community have changed in the last 5 years. We've shifted a lot of focus from like personal medical education. Now a lot of it's around policy, know your rights stuff, and also helping folks to be able to engage in the community while also providing safe space just to gather for enjoyable events. Like we've got a swim event coming up this weekend where we have a public pool that we have rented out for a few hours for gender diverse folks to come and just have a safe place to go swimming. And we're working on some programming for Thanksgiving and Christmas, just to give people, again, a place where they feel like they can gather as themselves. And then as far as the community work goes, we are the sort of backbone of a group called the Transaction Coalition. It's my job to sort of do the administrative functions of that group, and that includes a number of partner agencies that were already doing the work in our communities. And again, like Jay and Angela have said, about bringing funding to these people to continue and support work that we're doing. The idea is that it's very collaborative and information sharing, supporting what each other is doing, and then also having some shared focus, especially around policy advocacy in our state. And that's where Andy comes in. Andy is a youth pride and one of our TAC members, and somebody who I am talking with at least a couple of times a week most of the time. I hand it off to you, Andy.
Thanks, Ryan. Hi, everybody. I will just give a brief explanation of who we are and what we do as well. So we're Youth Pride Inc., YPI. We are a Providence-based LGBTQIA2S+ youth organization. We serve youth as young as 5 all the way up to the age of 24. And what we mean by serving them is it's a lot that we do a lot of different things. In Providence, we have a drop-in space that folks can come and utilize. And that's kind of what makes us very community-based, is we're right here kind of at the heart of things, where we can be very easily accessed by at least most people in Providence. You know, in terms of kind of community-facing work that we do, you know, that literally can mean anything from, you know, we have youth that come in here after school, for example, and, you know, get snacks and hang out and chill in our library, to groups. And then we have a whole services side that is very much needed, because before we had a whole bunch of services, we always had youth with need beyond the fact that they were LGBTQ+. Over the years, we have been trying to figure out ways to have resources for them. And I think that's in part where partners like Thunder Mist come in, because they're always working to, I don't know, ensure that we get to have the ability to implement those sort of things, or, you know, point us towards a direction or something like that. And then, as Ryan was saying, there's a lot of stuff that's going on outwardly in this the state as well, and like outward facing events, outward facing, like, we need to deal with this issue, we need to deal with that issue, and we try to stay as involved as we can, because literally whatever's happening at the policy level or the current political climate or whatever's going on, like, we have the people that walk into our doors that are affected by what's going on. And so we're dealing with them very much face to face. And we want to make sure that we're not only protecting them with like individualized services, but working towards those larger systems, policy, goals, responses, to make sure that we're kind of meeting them at every level.
Awesome. Thank you all so much for sharing. Obviously, like, you are working so closely together at the coalition. Can you talk to me a little bit about the process of getting to where you are now from where you were at the beginning?
Yeah, absolutely. Because I think there's a great learning story here that we've shared. When we created and like informed the and then named the Trans Action Coalition, um, we identified 5 partner orgs in the state that were either trans serving, complete and trans led, or just had like a really like specific focus around providing services to the trans community. And frankly, being a small state, like it was the people we were already often collaborating with on policy things, on, hey, you need to know this is happening in the community and what issue you're having over here. And we were having all these smaller conversations. And it was really gave us a chance to bring together our smaller community partners from these like smaller organizations and pay them to come into a room with us and to have these conversations and be able to look at setting priorities together and organizing our policy priorities a little bit versus it being scattered, and then being able to really focus that on the like sexual violence prevention, primary prevention strategies. So looking at housing and healthcare and education, and we added like vital records, like having accurate documents that match who you are, employment. So of really it looking at quality of life things for the community that are also prevention strategies. And when we started out, we really the plan was to use a consensus-based model. And like we're all friends, this is gonna work great. And it worked okay. Like there were some parts of it that it was moving okay. And then we hit a big snag. And the big snag was Thunder Mist is a much larger organization. And we're a program within a much larger organization. Working with small community partners on the ground who are like much more dynamic in how they can respond to things meant that Thunder Mist had a lot more conflicting, like conflicts of interest in funding sources and partnerships from other programs and other parts of the organization. That meant there were some things that all of our community partners agreed on doing and we could not agree to. And that created a lot of tension among us of wanting to collaborate together, because there were things that we could not operate on a consensus because Thunder Mist like could not consent to it. And lots of big feelings and lots of meetings about trying to defend things that I didn't necessarily agree with, but it was like the position of the organization that it wasn't about what the community needed, it was about something else. And that was the issue. If we're going to work with small partner organizations, we can't have a large organization overshadowing that to be like, but you can't do this because it's not our priority, or it's not something that we can support. So we ended up kind of like pulling apart the structure of what we were doing. Like we were at first we were trying to present things on behalf of the Trans Action Coalition, like as a group. And then we stepped back from that and decided we're going to look at the Trans Action Coalition as more of a gathering space to share and support each other's ideas. So that way, if there was an initiative that all 5 partner organizations wanted to work on that Thunder Mist could not support, we could still provide technical support and organization behind what it was that they were doing without us signing on to the name of the coalition supporting a particular issue. So because as the lead and as part of our RPE funding is to provide the guidance for the group. So we would still do that and the communication pieces and all of that. And that was all. So we came up with this, we agreed on it as a group. We went to the Department of Health to be like, hey, this is what we want to do. We want to change up how we're doing this. And I think that's a big lesson to be learned. Like they agreed with us that being it was like we were the bully in the room of these much smaller organizations when we all knew that what they were saying was exactly right. And so that's one of the challenges of when I look at the model, Ashley, that you used earlier, like the spectrum of community engagement, I want to say that we were a 5, but we were trying to go beyond the democratic process to a consensus model process, like an extra brave space to go to in this work. And ultimately the consensus became like, we can't operate it in that way because it was not fair, because we did not all have equal amounts of power in that space. And so we had to remove that piece of the power to make it more of this collaborative, we work together to support each other space, and to not that like iron fist, we all have to, if we don't do it, none of you can do it, because that just didn't make sense for what we were trying to accomplish.
That makes a lot of sense. Thank you so much for sharing, Jay. I'm curious for you all, what about this partnership feels transformative compared to other collaboratives you've been a part of in the past? And how was that intentionally set up and fostered?
So as I started to say earlier, like we were kind of doing this work unpaid, and I had put a comment in the chat that looking for this funding was really an answer to a problem that we were trying to solve already, which was there was a need for there to be specific paid work in this area. And as the health center side of the Thunder Mist program grew, I had less and less capacity to do policy work as also the person who ran this program that started with 500 patients and then 1,000 patients. I think by the time that the money started, we just passed 2,000 patients in our program, and was just like, we need more support. And the work was getting, there was more of it to do. And it was really being slowed down and held up because of the lack of capacity. And so what's been transformative for me personally, as someone who in this small state was the most visible trans person, where literally like everything was coming to just me. And I knew that there was a deeper bench out there in the community, but still I worked for the organization that had the power and people were coming to, of being like, we've got to change this. This has to be more collaborative. There has to be more people who are pushed, like supported into building out in leadership roles and having that voice. And so what's been most transformative for me is to seeing the leadership that's developed in this time of having folks in the role like Ryan, who are like having trans people leading trans policy efforts and getting support from our other folks in our organizations. But the being able to give that support behind the scenes, because I've been doing this kind of the policy and advocacy work around for a long time, and having that knowledge and helping to guide, but really giving leaders from smaller organizations the space to step up and to do that work, but also being able to use the power of Thunder Mist as a bigger organization to step in and get attention when we need to, and to make sure that people are paying attention to what's happening. And so that's like the good use of that power. The bad use of that power was when we were like trying to limit what was happening. Like we don't want to do that part, but we want to be able to use that power to highlight and to spotlight the things that we need to do. So I don't know if other folks want to say anything about the transformative, like just to get a room of people together who are trans, who are working on statewide agenda for policy issues, or like trans adjacent, trans like serving folks. When that used to be us texting each other at 10 o'clock at night and being like, when do we have time to meet? Maybe Sunday night at 8 o'clock, we can jump on a conference call, or like wild times. But now it was like set times that we can get together to work on these things. So that's the part that has been transformative for me.
I'll add a few things. The first thing I want to say, just so people have some context, is like Jay like used to work at YPI at one point. Like Jay like holds this level. I don't even know if we want to call it institutional knowledge, but like knowledge around all of these things in a way that most of us don't, because we weren't there from the get-go doing this work. So I don't know if I would call that part transformative, but I would call it deeply, deeply important, because like we have the person who has been through all the iterations of what's going on. And I'm going to say that what feels transformative to me and to YPI, we're one of the smaller organizations, right? Like we got eight staff and a couple of independent contractors that do clinical work here. We're tiny. And we very much, to this day, but not nearly as much as we used to, very much experience that overshadowing by larger organizations. And that in every sense of the word, platforms, where the money goes to for various projects and all of that stuff. And, you know, for a long time, it felt like we were shaking our tiny fists and being like, hey, like this thing is like so directly affecting us and the people that we work for, but like we have like no resources to be able to like provide. And that has really shifted. Not, like I said, there's still a long way to go, but there's been a real shift in that piece of things that like you know, there's been very intentional efforts made to bring small organizations like YPI to the table and give funding opportunities and things like that, that allow us to do things that we've never been able to do before. I think that the other piece about the collaboration that I find very transformative is, I'm sure this is not just a Rhode Island thing, and people who do this like kind of services work thing, but sometimes it can feel kind of prickly and competitive because we're often competing for, in the grand scheme of things, like small pots of money compared to other like systems that are funded, you know, and that culture has started to shift a little too, to me. That feels like it's not always prickly and competitive, but more that it's more collaborative. And now I know, like, okay, like I can send someone somewhere else, or reach out to Thundermist, for example, to be like, hey, this is what's going on. And as like certain things have been built out in the state, like they have reached out to organizations like ours, like Thundermist, to be like, well, we're building this thing out. We want to make sure that like these pieces are happening and need to happen. And so they're just kind of part of the process from the get-go now. And I find both of those things deeply important and transformative in this kind of work.
Thank you so much for adding that, Andy. So we've talked a lot about how you all got to where you are now. I'd love to hear a little bit about the actual work that you're doing together in your communities.
I see Jay mouthing my name. And sometimes my job is like air traffic control. I'm just keeping track of what's happening and then moving information along. And to the point of how we work together and how this sort of how this coalition is sort of transformative in the way we collaborate. And especially in like my role at Thundermist, a lot of it is just setting the table and then trying to bring people to it and saying, this is what's happening. You know, can we come together? How can we come together? And where can we do that? And also giving space for especially the smaller orgs to engage and shape what's going on, even if they can't necessarily hold on to it. For example, we've got an event that's happening this evening that we've partnered with a couple of orgs to do. And you know, we have sort of led the organizing of it and have gotten input along the way, just to try to make sure that's happening, that our workers are involved and represented and have materials and resources, things like that there. A lot of our work right now is focused around policy because that is the big issue affecting gender diverse folks right now. Even in Rhode Island, where we have traditionally led in anti-discrimination protections, for example, we were the second state in the US to pass them in housing, employment, and a couple of other areas. And we actually had a new law come online in this session that was preventing discrimination in healthcare settings. But to the extent that we have all these good things, they are also very much under attack from the national orgs that are organizing in all 50 states right now, trying to roll out efforts across the board for gender diverse folks. And so a lot of the work that we're doing right now is on that. It is following the actors in our state who are agents of you know, that movement and these bigger organizations from outside Rhode Island who are trying to force harmful changes to our pretty good policies. Unfortunately, so that's where we're concentrated a lot of the time, and then also where we can support what's happening in the community. For example, Trans Day of Remembrance is coming up, and there's a couple of orgs that are leading two of our other TAC members, Project Weber Renew, which is focused on harm reduction, and TGI Network, which is focused on providing peer-led support for trans, non-binary, gender diverse, and intersex people, are leading efforts to plan a Trans Day of Remembrance celebration. And something interesting about just the way we function in that coalition is that the city of Providence, our biggest city, came to us and said, hey, what's going on for this? Does the community have any plans? And they came to me as the visible, recognizable person at Thunder Mist with the resources who's just always out and showing up in all kinds of spaces. And I was able to connect them with our partner orgs and say, oh, great, here you go. These are the 2 orgs that are planning it. This is what's happening, and set up a meeting to talk about space and funding and access to resources, as well as institutional support in the way. So that sums up a lot of what's happening in my world right now. And I think, of course, Andy, services on the ground, and Jay running our whole trans health program definitely have some broader perspectives as well.
Thank you. I know you all are doing. Oh, go ahead, Andy, please.
No, I was actually not going to say that. I didn't have much to add because that was really comprehensive, and yeah, kind of hit all the marks.
Great. Well, thank you so much. And I also know that you're all doing a lot in regards to housing, and you hosted a roundtable discussion in 2020. We'd love to hear the story. We talked a little bit in kind of the background and the prep calls for this, but the story of how that roundtable came to be. And I will just say at this point, I need to step away from my computer for a brief moment. So I'm going to bring Ashley in to kind of continue with the questions as we share that story, but I'm still available to help people on the back end.
Awesome, thanks. So we held a housing forum. This was early on in our TAC coalition, or the Trans Action Coalition work. And it was like when we first got the organizations together and laid out our priorities, we identified that housing was top priority. And really the state trying to take a housing first model about everything people are gonna feel safer in every way if they have a safe place to live. And so we looked at like, what can we do for housing? Like, what are the issues? And while exploring that, it really came down to needing to create a space for the folks who are running the different aspects of housing organizations and like housing work to hear from the trans community. And so Thunder Mist partnered with the Department of Health. We used, there was like an official invite that went out from the director of the Department of Health and our CEO that went to the CEOs of like every housing related organization in the state. It was like the realtor related organizations, it was the like HUD funded shelters, but also like the Coalition Against Homelessness, and every related external, like who provides funding for housing services that we could find, and got all of these like big leaders into this room. And so we had all of these leaders into this space. You can imagine like people have a lot of things to say. We got them all there and then told them they weren't allowed to talk, which was great. They would not, a single other person was given the microphone, and then like our CEO gave a welcome, the director of the Department of Health gave a welcome, and then it was turned over to the person who is V, who was in the role before Ryan as the policy specialist, to host this event. And the event was organized with like community members with our partner organizations to talk about their experiences trying to go and look at apartments and being told the apartments is taken as soon as they show up, and the experiences in shelters of being assaulted by security, and all of the different aspects that happened. And so we provided support for those community members to come and do that. We provided one of I think it was Project Weber Renew, provided like a stipend for the people who came to make sure that they were paid a little bit for their time. We brought food in for the people who came and talked, and had a separate room set up for the community members to be able to step out and have a debriefing, like green space away from the room if they needed that space, and had myself and other like clinicians were available to make sure we were monitoring that space. We were asking folks to talk about some hard things that were happening. So we like did a lot of protective things to make sure it wasn't just putting the community on display, but really allowing hard conversations to happen and supporting that the best that we could. And then from there, we allowed for the last bit of the time for small group discussions. So they were all assigned seats in this room, and there were community members who were spread out at all the tables with all of these leaders, and they got to have small group discussions. And the small group discussion that was led was, what are you going to do with this information in your organization? And it was really putting that onto these leaders. So it was wonderful. We got great feedback about it. And there was a plan for a follow-up meeting. And mind you, this is January, like the end of January, the last week of January 2020. We had a follow-up meeting that in February we were going to plan to have in March to give people a little bit of time to digest this. Then we all know what happened in March of 2020, right? That went right out the window. There was never a follow-up meeting. It never happened. Like the processing of what those folks learned and experienced, we didn't get there. But I can tell you what's happened in the year since then. And this is where like Andy being able to speak up of like what has happened with YPI is, even though we didn't get those groups back together to do it, we saw a shift in how funding was allotted and who was brought to the table in those conversations. There was no LGBT shelters at the time. There's now 2 adult shelters, like an adult shelter in the state and one like young adult specific shelter in the state, and that are specifically LGBT. The I don't like taking credit for that work, but I think the forum, we primed the well, and we really got people thinking about like, what are you doing to address this piece of the problem? And so we've gotten to see the widespread effort of that. So it's like one of the proudest, it's like biggest, like gutsiest things that we did. And it was right in the beginning, and it was sad that the momentum didn't continue, but we can see it. Also, this kind of work, policy work, folks need to know that one of the hard things about it is it takes years, right? So like it happened and we're like, okay, now what? Well, you couldn't look back 6 months later while we were all in the middle of the pandemic to be able to be like, did that have any impact? It took years from 2020 until this past year to be like, you know what, we can identify these programs. And YPI, and Andy, like your experience with that is that shift in funding that's come through with like the youth focus that it really has had focus on our population.
Yeah. Yeah, so like what I can speak to for YPI, I was actually at that meeting. I wasn't yet hired at YPI. I got hired in March of 2020. So it was definitely a wild time. But yes, like what Jay is saying about like, okay, the second meeting never happened, but something stuck with enough people that had clout. And we got, so, you know, pandemic happens, we're on lockdown, and YPI has been and had always been a place where there were lots of folks that were unhoused, unstably housed, homeless, you name it, coming through our doors. And the most resource we had was someone from another agency would come and, you know, like do like essentially street outreach work with some of our kids. And then, you know, when lockdown happened, like there was money that was shifted towards like emergency housing in the state. And so the first thing that happened is we got approached twice. We have an organization here called the Rhode Island Coalition to End Homelessness, the Coalition, who is a big player in housing money. And they approached us twice to be part of projects around monies that were provided during COVID for housing for young people, defined in the state of Rhode Island, 18 to 25. One grant we didn't get, the other grant happened. And so we all of a sudden had some functionality that we had never had before. And then the YHDP, which is the Youth Homelessness Demonstration Project, that got started in the state of Rhode Island, and they were extremely intentional, like about this, bringing all of the small folks like us to the table. And not only brought us to the table, we had like a year-long steering committee on how this was going to work before like even applying for the monies. But then we but then really very dedicatedly gave out large chunks of that money to small places like ours, like the LGBTQ plus shelter that Jay referred to, which was in its infancy at that time. I would say that like part of that was they had a YAB, which is a youth action board, that was a big part of driving decisions around how that money was allotted and everything. And almost positive that members of the YAB were at that initial meeting back in January of 2020. You know, so that dedicated effort really came into being. And like, again, you know, it's housing, like there's still a lot of gaps that we're trying to fill. But we have unprecedented resources and access, as you know, as that small organization doing that work.
It's it will never get old for me to hear you tell that story. It's only my second time hearing you tell it, but it really is such an incredible like example of shifting power, and letting the community say these are the solutions. You all have the power to actually change what we need. So just thank you for bringing that here. I know that when I initially reached out to you all, part of it was because I had heard about some policy work that you had engaged in around housing and trans people being harassed. And you were able to make some policy shifts around that. I'm wondering if you would share a little bit about that, because I think that's another like really clear example of problem being identified and a solution being implemented.
That piece feels so long ago now that I'm like, oh right, that is what we initially started talking about. Because that conversation and that quick solution is what led to the housing, the big how like we just need to get everyone in the room and talk about this event. They kind of, it was like the very first meeting of the TAC partners where it was like more than one organization had a shared experience with the same client. Like we just knew about the same, like it was one like really horrible thing that happened at a space. So we had thought there had been a problem that had been solved in the past. And we're like, oh no, that's not supposed to be happening. And we're able to then go and step in to talk about this with the shelter. And it was around making sure that the shelter had accurate identification for their clients who were housed in the shelter. And so that their ID badges matched who they were, because security was claiming they didn't belong in the space and was harassing them to get them out. Or it was saying like, you're in the wrong shower, you can't be in here, and like drag someone out of the shower, like while they were in the shower, saying like you don't belong in the space. Like it was so violating, and we were so angry about it. And being able to go, and again, like Thunder Mist having the level that we have to go and like have a big discussion, a hard discussion with that other like larger surveying shelter or like organization, and then being like doing some training specifically with that staff. And we did come up with a solution around the IDs that they had that would stop security from like questioning whether they belonged in the space. And then that led to the bigger, we need to do this. This is a much bigger issue than just this one shelter. And that was the bigger conversations that came.
Thank you for going back in time, Jay, with that and connecting that timeline for me.
A piece I can add to that, like one of the funny, not funny parts at all. That's really dark humor, funny, like weird, funny, I guess, is that they were trying. So one of the things that happened, it was not that big incident, but another thing that happened around the same time was that there was some training that happened. And so it was a trans guy who showed up at the women's shelter, and they were like, but we're going to send you across town to the men's shelter. And he was like, no, I don't want to go there. That's not a safe place for me. And they're like, but we're affirming you. We're sending you across town to the men's shelter. And it was like, but no, I haven't changed my ID. I haven't had like, that's not actually, I just told you to use a different name for me. I'm not telling you to send me to a different shelter. Like, why does those things? And they were like, we're affirming you. We're going to send you a different shelter. And this being Rhode Island meant that this very upset person called a friend who called me at 9 o'clock on a Friday night to be like, can you fix this? And the reason why that happens is because like I did have the number of the person who was supervising the shelter and could call, because that was a neighbor, to call and be like, hey, you need to call your staff right now and deal with this, because that's what happens. And Rhode Island is like rural, but in a state. If you take like a rural county, but it's like all of us in the whole state, right? So that's how that happened, and then we were able to fix it just because we knew a thing. We were like, there are bigger problems here. We need to really come up with some sort of big intentional way of trying to address all of these things at the same time, because everyone needs to hear the pieces of the same story. It's the same story around the experiences folks are having with housing, to figure out what their role is in fixing it. Because we can't just tell each person what their role is in fixing it. They need to just hear it and feel it, and then figure out for themselves also if they're really getting it around like, what can I do to make this better? And that was the task that came out of that coalition, the large like housing meeting.
Thank
Sorry, Ashley, I just wanted to say, I think that's also sometimes the power of what we do, especially around tech, is that there's a network and you know who you can call. Or if you don't know, you can at least reach out to the folks that you work with and have a relationship with and say, we're having this problem, how can we fix it, or who do we need to go to? Which I really appreciate about the way that we function as a group.
Yeah. Thanks for lifting that up, Ryan. I mean, as we've been talking, you know, I have never been to Rhode Island, but I know that it is a tiny state. I know listening to you all talk, you can feel that. And so there might be some hesitancy in thinking like, well, of course, like this is something that you can do in a very small state, but what happens in some of the larger states that are a little bit more disconnected, they're larger geographically with population, all of that. But I think, Ryan, what you just said, like there are networks everywhere. And you know, that I can't, you know, I'm in California and there are so many times where doing this work, you start to connect who knows who and who worked with who and who used to organize with, you know, this person. And so those networks and connections exist regardless of the size of the state. It's just, are you part of them? Are you out there making those connections? Are you talking to people? But yeah, it's just really incredible to, like, these are the things that you can't count when you're reporting on a grant that like I mean, you could, but you know what I mean? That someone called you at 9 p.m. on, you know, a Thursday night and you helped with this situation. And those are things that are really helping to change people's lives.
I just want to add really quick, Ashley, too, that like it's even, you know, are those networks connected to one another themselves too? Because I think that's part of it. Like Jay and Ryan both sit on our statewide prevention coalition, so they share information from TAC with our statewide prevention coalition. So it's building the networks across networks even. And they are very responsive, really have their, you know, their fingers on the pulse, and you know, I'll tell them, hey, I heard about this thing and I just want to know, you know, is it on your radar? And they're like, yeah, we've organized this already about it. And you know, certainly, and you've even seen more recent examples of people coming to the community with, you know, concerns that they've experienced in hospitals, in school settings, things like that. So they have been, you know, a real champion in our community.
Thank you, Angela. That's a fabulous point. So, you know, obviously we are talking about LGBTQ justice. And if we're going to have that conversation, we have to acknowledge and address what's happening in our national landscape, and how that's really impacting individuals and communities. And so I'm wondering what's happening with Thunder Mist and YPI when it comes to what's happening nationally. We have a national audience here with us today. Talk to us about that.
Nobody's jumping on that because that's my job. I touched on it a little bit, and you really can't miss what's happening in the rest of the country if you are tuned into the mainstream news at all. And it sounds like a ridiculous conspiracy theory, but it's actually happening where there are these large organizations that have millions and millions of dollars in funding that are working to push anti-trans and anti-LGBTQ more broadly policies across all 50 states. And it's the same folks that were opposing gay marriage. It's the same folks that are leading the anti-abortion movement, and they've kind of just concentrated their knowledge and their funding and deployed it against trans folks, really specifically. And then again, of course, LGBTQ population more broadly. Yeah, and as far as connecting that to what's happening in Rhode Island, and I'm sorry, we're doing an event on this tonight. I have a whole monologue written out that I am delivering in a couple hours, all about this. But as far as what's happening in Rhode Island, they are working at the level that a lot of others efforts at a lot of other states started. Which is targeting young people in particular, and school policies especially. So in Rhode Island, we have had mandates from our Department of Education that all school districts have to have policies that follow national best practices around supporting trans youth who are in their schools, and non-binary and gender diverse youth as well. And there's a group of people that are going around trying to find a school district to just oppose or defy, I guess is a better word, those regulations from our Department of Ed, create a policy that would be harmful to trans students by outing them, by forcing them into gendered spaces that don't align with their affirmed gender. And basically the end goal is to force a lawsuit, have a court challenge, and try to bring the law down in the courts, which is a playbook straight out of, or a tactic straight out of the anti-abortion playbook, because they're not gonna find success passing a state level policy through our elected public bodies, but they might find success in the judiciary, for example, and so that's where they're going.
Mm.
And so we're organizing around that. The event that Jay mentioned this evening is a community gathering to help educate folks who are wanting to engage about what's going on, and also just developing allies and people, engaging people in their local communities, especially because that's where the issues are happening. And is as much as Jay and I get paid full time to be professional trans folks and engaged in policy work, it's really hard, even in Rhode Island, to show up in 35 different school districts while we're also trying to do programming and training and positive work and work on positive legislative efforts as well. So that's kind of where we're at right now.
And so the look at, how do we, like, in the shared power is really, people are coming to us and being like, you have to be in the space and you need to be here. And it's like, it doesn't actually have to be us. So we're going to help you all to feel like you can be the ones to be in that space too. And so that's with the orgs that we're partnering with tonight, to bring people together and help them see and understand what the options are and make those connections. So we can do ally training and helping build a network to respond at the local level. So it's not just us running out there to go and do this. And the partnership with Youth Pride, one of the things connected to this was working together to go to the Department of Education to request a meeting to find out, like, what are you doing with these policies? Like, what would happen? And because already we know not every town has a robust policy. And so trying to use our power and bringing our partners together to go and to challenge and to have those conversations. Like, we primed that conversation with them on, like, we need you to go and look at what all of the districts are doing with these policies, because we know there are problems. And then Youth Pride took on a piece of that work to do some intensive community information gathering about those qualitative experiences, which we haven't actually shared out yet, Andy, but I know that your team was working on it.
Yeah, we're actually, I just got to send it to you because, yeah, so when we, I think Ryan, you reached out and you're like, we have a meeting with RIDE, you know, in a day or something, like, because that's how fast these things happen. It wasn't because Ryan has never like drops the ball. Like, I know that it was a very quick thing on Ride's end. And they were like, can you come? And we were there. And then, yeah, we ended up doing, we're like, we hear experiences all the time, especially as like there's a ton of LGBTQ plus facing organizations in Rhode Island, but just because we're like the like pride organization for youth, a lot of people walk in our doors and tell us stuff. And I was like, well, would it be helpful for us to collect this data about like these qualitative experiences of being in various school districts in the state as either trans or parents of trans youth, and what their experiences have been like, and do they know the policies exist where the school's resistant, you know, like whatever. So we ran interviews for about a month and a half, and we collected that data. And yeah, and we have that to present to whenever we finally have that second meeting with Ride. I think, you know, the just kind of going back to that original question about like kind of the state of things, right? As we've stated, yes, like Rhode Island is protective in a lot of ways. We're certainly not a state where we feel like imminently like that some of this like nasty legislation is going to get through that's gotten through in a heck of a lot of states in 2023. But even like, you know, school policy is a very good example. And Jay, definitely correct me if I'm not understanding the policy perfectly. But it is up to the individual districts to like really implement the policy like in their school, at least as it's written, or at least that's what's Ride is saying is the truth. So like we get these youth reporting to us all the time that they're experiencing like very transphobic, harmful behavior on, you know, the administrative part, on the school culture, etc. So even though maybe the laws are either not against them or in some cases like even exist, like that is still hitting our youth in Rhode Island. And they're still very much experiencing some of these things, even if at least at the moment we don't have to worry about them losing access to gender affirming care. So it's very real, and it's tense around here.
And we're in a supportive space, right? Like,
Yeah.
this is a state that we really see as pretty safe and protected and like well resourced around these things. And so I know those of you who are, I saw Kentucky and all different parts of the country, like my heart goes out to you, and for other folks in also in more like blue and protected states. Like, we can't be complacent with this stuff. It's just, and we can't like ignore it. It's kind of even though taking up the energy, it's just fueling itself. So even if it seems like it's fringe and ridiculous, here it's a very small number of people, but they're very loud. And so we can't just ignore it and let them like yell off in the corner, because it has to be met with greater opposition. Because just sort of being like, ignore what's happening over there did not work for us the past few years. It's just gotten worse. That's just a national community strategy, like LGBT. Like, we all just sort of were like, we're just not gonna do that. And then it really blew up in all of our faces in the past year.
And I'll also add that we're starting to see it at YPI. The youth, the young people that have fled, that are fleeing other states, are starting to show up on our doors. So like, I mean, of course we have the like moral imperative and obligation to make sure that we're helping the newcomers just as much as people who were born and raised here.
Mm-hmm.
Absolutely. Thank you so much for wading into that conversation with me. I think in California, it's similar, right? We have a lot of protections, and at the local level, school districts are really chipping away at those. In fact, I think I just saw that the school district that I grew up in just voted on a parental notification policy. So there are things being, happening at the school district, even in California, similarly to what you all are seeing in Rhode Island. And we've hosted some spaces in the last couple of months with sexual and domestic violence prevention practitioners who are, you know, kind of being forced out of schools just because the curriculum is inclusive of LGBTQ identities. And many of those practitioners are queer themselves, and so also feeling a level of not feeling safe. And so it reminds me, Angela, back to your point about the need for trauma-informed prevention, like when your human rights are being stripped away, and also like it's your job to work on these issues, like that feels very heavy. And you know, that goes for a lot of social justice issues and identities. But I think that is maybe where like partnerships and power sharing, like what is burdensome and what can partners take off of people's plates in moments where it's just too much. I'm looking at the chat real quick. I know that we are coming up on time, and so I really want to know from you all, where do you see this work going in the future? Like, what are your hopes? What are your goals? Anything, just looking ahead, plans maybe?
I would love to see us be able to expand and add a second person to our team doing policy and training work. You know, I was just asked for it all, Angela, around because the capacity wise of being able to do the training pieces are, Ryan is so flat out, and my ability to support that, right? So just there's a need for more, but also there's the more internally like staffing, but you know, bigger than that, I would love to see the coalition able to bring in more partners, be able to pay them more money to be at the table, like just more money in general will just help us to be able to like do the work that we're doing. Because there are more partners who have come on board, the other shelters that should also be at this table in this conversation, but they were not part of this contract. And being able to create some like community member voices, people who aren't actually connected to any of the organizations, to be able to fund a few of those folks to be able to come into the room. And so that takes money, because I don't want to I don't want to just invite people to come in and have the power of the few orgs that are getting paid a little bit to be there, like not very much, but like, and then have folks in the room who are not getting paid to be there, and being able to have more money to share that with the coalition. It's just going to help to strengthen it, because we've seen already in the past 5 years just how many more people that have the visibility that like not everything is coming through me, which was a really like selfish goal to have, but very much about like sustaining, like self-sustaining of the work, of having the work never being reliant on one person. And that, like, you know, I could retire, and I'm way too young to retire, but like could retire and like things would function, and there are many other leaders here who'd be able to carry that work forward. And that was always my personal goal, was to make sure that this was a community-led sustainable effort. So like money would help.
I just have to say, I want to hear from you all, but that piece is so important, because I've been part of so many like amazing collaborations, but it's really held because of the individuals. And once those individuals move on, for whatever reason, right? Like, because there hasn't been that sustainability piece. It just kind of like things fall apart. So I just, yeah, that's so important and incredible that was like your mission.
It's going to become someone's job, like it's going to be held together. So the position's going to be there, and the position will make sure that we keep bringing folks back together and keep like, and provide that support to them. And that helps to make sure that it's not just folks getting together ad hoc that will just sort of trail off because everyone's busy doing other things. Like, this is someone's job to make sure that we also pay attention and get back in the room together to keep the work moving. Because everyone wants to do it, but the time to do it gets really hard. And that's why we were able to help guide that, and then pull in everybody. We know what their goals are, we know what their priorities are, and then being able to pull folks in as things come up to make sure everyone's aware of what's happening. Even if you can't be here, we're going to do this. you want us to put out tabling materials for you? Do you want us to make any announcements for you? And to make sure that the voices are in the room and that we're driving that forward, even if folks don't have the staffing or the time to be able to make it to each individual event.
Thanks, Jay. Any other ideas of what's ahead for you all?
I'll try to speak to it super briefly as I see the time. One of the interesting things about being a lot more collaborative and having like a lot more connection and resources is that it ends up really emphasizing some of the gaps that still exist, because all of a sudden you're like, hey, but like I know so many more things than I used to, and I still can't get the thing for, you know, this person or, you know, this community or whatever. So this is an absolute dream, and you know, but like hopefully some of our bigger partners are going to be able to like help us figure out how to secure this. Like I really, it comes down to money, but to me it comes down to like emergency funds. Way bigger than that is like universal basic income, but like some version of that that would really incredibly help fill in the gaps that are like community need. Because I don't know, like sometimes the answer really is if we could throw money at that, we could, it could be transformative for a person, it could be transformative for a community. And we could get the need met that isn't getting met. So I've been starting to dig around trying to figure out avenues to make that a reality. And that's part of what's ahead for us, hopefully.
Yeah,
I've had that secret hope, Andy, for like an emergency fund, like statewide. Maybe that's something that the coalition can talk about. Like, how does the coalition, like, there's one in Massachusetts that they have a trans emergency fund, and it's been around for a very long time. And I've always been like, why don't we have that? We need to do that and to create that as well.
100%, Jay. I'm down for yet another meeting. Let's do it.
Awesome, let's do it. We're here, real time. It's happening right now.
I'm like, wow, look at this modeling. So good. I was, you know, you always hear money can't buy happiness, but I feel pretty happy when I'm not stressed about money. So like, come on, it's a big thing. It's, you know, if you can't meet your basic needs, I don't know how we get to our optimal health. Ryan, Angela, any closing thoughts from either of you?
Are we playing chicken, Ryan? I think, you know, certainly we would love to see this work continue to move forward and to continue to tackle new emerging issues here in the state. I mean, I think that the work really honestly speaks for itself. The outcomes are just hard to ignore. So appreciate the work that our partners, the really brave work that their partners have been doing, and I know personally taxing work. So thank you all for the work that you've done here in Rhode Island. I know it means a lot to members of our community, and certainly gives me a lot of pride to be involved in this work with you all.
It's hard to sum it up, but more, bigger, faster, as a friend who's a retired Navy officer likes to say. For me, we're stuck in this like defense zone, which is really frustrating. And I would love to see a lot more push on positive measures and being able to get out into trainings and working on building safer spaces, because the legislation and working on laws is great, but actually if there's no community shift to back that up, it doesn't really matter a heck of a lot to the individuals and then people's daily lives. So I would really love to see, more capacity and bigger and better and faster, and being able to support our partners and advance the work in a lot of different ways.
Thanks, Ryan. Well, I just want to thank all of you so much for being willing to have this conversation, share about what our PE work has looked like in Rhode Island, and then get to hear from sub-recipients who are actually doing the work, have made incredible strides. And I wish you all the best with your event tonight and with the swim event. And of course, we'll be doing all of like the praying, wishing, hoping that the legislation stops coming. And I just also want to thank all of you in our audience for being here. Thank you to our captioners. Thank you to Janae. We could not do this without every single one of you. When you do close out your Zoom, there, I believe, will be a SurveyMonkey link that pops up. And if you complete that evaluation, we really appreciate your feedback. There will be a certificate of attendance if that is of interest to you. And then we'll get the recording of this up as soon as possible and let you know that it's there. This is the end of our session on integrating health equity. Thank you for joining us for 4 sessions. And we'll look forward to seeing you with more web conferences in December and January. But thank you again. Ryan, Jay, Andy, Angela, if you don't mind staying on for a couple minutes, that would be great. But otherwise, everyone, thank you so much. This will conclude our web conference for today. Take care. Okay, I think that I have that. Is it, oh my gosh, was it Tiffany? I think we're alone now. Was that that literally just like came in my head. Okay, I think it's just us. I guess Janae did have to drop off completely. But I know that and was sorry that something had come up. How do you all feel?
We're gonna stop the recording.
Oh yeah, sorry. I'll have to edit that. I am always like, oh well, now I have to cut it.